The fear of your wedding night. The terror of a romantic getaway. The angst of making babies. They're supposed to be the biggest nights of your sexual life.
Pressure is being the first time as man and wife. Yeah, you really want that to be nice.
But what happens when the pressure mounts? Will you be able to do it? How to perform for the big event. Berman and Berman is next.
Welcome, everyone. We're talking about today the big event or the big night and the anxiety that's associated with that, especially related to sex.
Performance anxiety. So whether it's sex on your honeymoon, the first night of your marriage, or if it's sex for that big weekend away, or if it's sex when you're trying to get pregnant, there's big events around our sexuality that can create major anxiety, and we're going to talk about what that is and how to deal with it.
I'm Jennifer Berman.
And I'm Laura Berman. I'm a sex therapist, and Jennifer's a urologist.
And our topic today, performing for the big event. And we're not talking about Carnegie Hall or the Academy Awards. We're talking about performing in the bedroom.
Right, and whether it's your wedding night or a romantic weekend getaway, how can you be sure the reality will really meet the fantasy?
For most people, success for the big event means one thing: orgasm.
Is it important for your partner to reach an orgasm?
Well, you know they're going to every time. It's a guy.
Not necessarily.
It's a question of whether or not we will.
You know, there have been times in which neither one of us have, but it's still been enjoyable.
I just feel like orgasms aren't what sex is all about. There would definitely be guilt, though, if he doesn't. I love them, but I don't always have to have one.
Definitely. You're coming first.
So what can couples do about the big event syndrome? Thank you, Laura. Let's get some answers also from the author of 12 Steps to Everlasting Love, Dr. Ava Cadell. Welcome.
Hi, Ava.
Thanks for being here. So, you know, in terms of this way in which Laurel was talking about how couples sort of disconnect, do you have any clues or tips about how they can reconnect?
Well, exactly. Reconnect is the word. I think this is an opportunity for couples to enhance their intimacy, expand their sexual horizon, and improve their communication. Don't just make love in the missionary position, you know, in the same place at the same time when the time is right. Ladies should still try to seduce their man. Don't just expect him to be aroused just like that.
Right.
Men need some visual stimulation too.
Right.
So even though there's a goal to make the baby, you've got to vary the positions, maintain the intimacy,
foreplay,
yes,
seduction, all that stuff, erotic
stuff.
talk, oral sex, sex toys.
Right,
I mean,
and that's
why eliminate it all?
Right, and that's why I think the work that Dr. Klein does is so important, because what happens is that women and men, but if we're talking about women seducing their husbands, it gets so emotionally loaded, and they're so tense about it and so anxious that to suddenly make that mind shift to woohoo, honey, let me seduce you is really hard. So I think
that's exactly it, the mind shift.
Yeah.
You have to have a positive mind shift, especially if you haven't been able to conceive for months, for years. A positive mind is more important than success or failure.
And the reality is, the less stressed you are and the less focused you are, the more likely you are to get pregnant.
And that's why we hear so many stories about couples finally adopting and then getting pregnant. Or
once the pressure's off.
Yeah.
And orgasm. If a woman has an orgasm, she's
point.
more likely to get pregnant.
Yes.
Yeah. Because the uterus opens up and the contractions help.
The cervix dips into the pool of semen, especially if she orgasms after he ejaculates, because it sucks it all up into the uterus and gives those little sperm a head start.
And the same time isn't bad either.
Yeah, the same time isn't bad either.
Sex doesn't have to be serious, even if it's for procreation.
Right.
It's adult play.
Right.
It should be fun.
It absolutely should. It's just, I think it's great advice. It's just a challenge, I think, for a lot of couples to do that, and especially after trying for so long. I mean, what's your idea of advice about how a couple may make that mind shift?
Well, basically by not blaming each other, by trying not to get depressed, by having a positive outlook, using creative visualization. One day we're going to have a beautiful baby, and until that day, you and I are going to have quality time with each other.
Right. And taking a break, I mean, people go from cycle to cycle to cycle. You know, I would think that it's good to, you know, have a cycle, take a break, have a cycle, you take a break, because they just, you know, just
That's
because,
true.
you know, the anxiety and the pressure builds and builds and builds, and then the first cycle doesn't work, the second cycle, and they say, okay, one more cycle, and then if that doesn't work, you know, the relationship goes into crisis, and sometimes they even separate.
The truth is, the baby is going to grow up, fall in love, and leave home, and you'll have a loveless relationship. So
you have to pay
intimacy
attention.
must...
And know that if you can't make those shifts on your own, that you may need the help of a professional or a therapist to help you.
Don't be afraid to ask for professional help.
Because sometimes it's hard to do on your own. Well, thank you, Dr. Cadell.
You're not alone.
Yes, you're not alone. So thank you, Dr. Cadell and Laurel Klein from the Mind Body Institute for Infertility. And when we come back, fear and the weekend getaway.